Coronary artery bypass surgery in patients with ischemic cardiomyopathy. Definition. Coronary bypass surgery is a surgical procedure that diverts the flow of blood around a section of a blocked or partial blocked artery in the heart by creating a new pathway to the heart that improves blood flow to the heart muscle. Ischemic cardiomyopathy is a type of dilated cardiomyopathy caused by a narrowing of the coronary arteries which supply blood to the heart.
A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle in people with severe coronary artery disease. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. One or more coronary arteries may be bypassed during a single operation. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. During a conventional bypass surgery, your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system will be connected to a cardiopulmonary bypass pump or heart-lung machine. This machine temporarily performs the functions of your heart and lungs during the surgery, allowing your heart to be stopped while the surgeon sews the grafts into place. One of 2 blood vessels is typically used for the grafts: the internal thoracic artery in the chest or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery just beyond the blockage. Your surgeon will then sew the graft into place. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. With the graft securely in place, your surgeon will use electrical signals to restore the heartbeat and attach a temporary pacemaker to the heart. Once your heart is again beating normally, the heart-lung machine will be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. A temporary drainage tube will be placed through the skin beneath the incision.
Applications in medicine. The coronary artery bypass surgery is the preferred treatment for disease of the left main coronary artery, disease of all 3 coronary arteries, the anterior interventricular branch of left coronary artery, the left circumflex artery, and right coronary artery. Diffuse disease not amenable to treatment with a PCI. High-risk patients with severe ventricular dysfunction, low ejection fraction, or diabetes mellitus.
If we look through the chest wall, exposing the lungs and pericardium, which is the fibrous covering of the heart, we can see the heart actually beating inside the chest cavity. There's the left coronary artery up close, and the right one as well. They supply blood to specific regions of the heart. Damage to or blockage in either of these vessels can injure the wall of the heart. If we focus in on the left coronary artery, you can see the red blood cells traveling through it unimpeded. But if the inner wall of the coronary artery becomes damaged, cholesterol plaque can build up, progressively narrowing the available pathway through which blood can flow. Clotted blood attempting to traverse the blood vessel may find it tortuous and too narrow for passage, and the artery may become completely constricted or blocked off. The blocked artery results in a lack of oxygen or ischemia to the part of the heart muscle that the artery supplies.
The pros and cons. Pros: having less chest pain or having chest pain go away, lowering your chance of a heart attack and having more energy for physical activities. Cons: heart attack, stroke, bleeding during or after the surgery, a change in kidney function, a lung infection, arrhythmia, an allergic reaction to the anesthesia or other materials used during the surgery, and in rare cases, death.
So cardiac bypass can be a lifesaver in the right patient. If a patient has a weakened heart, for example, bypass can actually prevent future death rates. Bypass is one of those things, and how can it do it? One example is, remember we talked about ventricular tachycardia. People who have blocked arteries or weakened hearts, they tend to have very abnormal rhythm disturbances. So, and that's because their heart's not getting enough blood supply because of blocked arteries. So if we fix those blocked arteries, that can help the heart's function improve, and that decreases the risk of death. Bypass can prevent issues such as congestive heart failure, because again, it can help the heart strengthen over time. Frequently, though, it can also be used to get rid of the symptoms associated with heart disease, such as that angina. A lot of patients who have blocked arteries can't walk far because they get that pressure or tightness in the chest, and frequently a bypass can alleviate those symptoms as well. But of course, there's an inherent risk. I mean, the risk depends on the individual patient, their age, their whether or not they have kidney disease, lung disease, that type of thing. But generally, less than 3% risk of heart attack and stroke, death, and those are kind of the major risk factors. But people can have infections, bleeding issues, and that type of thing as well.
Issue apply in Ecuador. According to data collected by the INEC in the year of 2014, reported a total of 4,430 deaths from ischemic heart disease. Of the total of deaths from heart disease, which amount to almost 12,000, 51.68% of the victims are men, while the remaining 48.32% are women. In the Teodoro Maldonado Hospital of the ES in Guayaquil, the 9th coronary bypass surgery was performed with arterial and venous graft to correct an obstruction in a coronary artery and prevent infarcts. The patients submitted to this surgical intervention present improvements in their health in relation to the symptoms that they presented by ischemic cardiomyopathy, such as chest pain, physical tiredness, and difficulty in breathing. Dr. Juan Carlos Medina, cardiovascular surgeon of this hospital, along with other specialists, said that it's like building an overpass in an area where there is a lot of traffic. The graft of the internal mammary artery goes inside the chest. We dissect that artery and attach it into the heart, doing the coronary bypass, they say. The surgery at a private level has a cost of $45,000 with hospitalization. use of surgery rooms, medical fees, and other services. In 1 week, the patients go to the recovery stage and then follows the respective medical controls. The cardiac surgery service of Teodoro Maldonado Calvo Hospital started 25 years ago and has been strengthened with the implementations of new technologies. The conclusion, in my point of view, bypass coronary surgery actually is the most useful technique for treat ischemic cardiomyopathy. Although it improves blood supply to the heart, it doesn't cure underlying coronary artery disease. The results and long-term outcome will depend in part on taking your medications to prevent blood clots, lower blood pressure, lower cholesterol, and help control diabetes as directed, and following healthy lifestyle recommendations such as stop smoking, follow a healthy eating plan such as DASH diet, maintain a healthy weight, and the exercise regularly.
Output to do whatever activity is ongoing. And we can go around those blockages and provide blood flow to the heart, but we don't cure heart disease, or we don't cure arteriosclerotic occlusive disease of the heart. The blockages, by and large, remain in place. We're simply going around them, but it doesn't take away the causes that put the blockages there before. And by and large, people with diabetes, people who smoke, high blood cholesterol, increased lipids, triglycerides have now been shown to be an independent risk factor, and hypertension. All of these things or conditions put people at risk. I many times say if you live long enough, you're probably going to develop some blockages in your heart. But if you have any of these other conditions, and the two that I say are just absolutely death knell, if you have diabetes and you smoke, you're asking for it. And you're going to develop blockages in your heart much, 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 much earlier than you would if you did not do those things. It's a good operation, and it provides a lot of good quality of life, and we've got studies that document that it lengthens your life, but it doesn't take away those issues that put that blockage there to begin with.
Thank you for watching.